Hello and welcome to this introductory webinar on Healthcare Intelligence Portal. The aim of the webinar is to help new users to initially log in and access the tool, and also to provide a broad overview of what's available within the tool. Further training webinars will be available to support new and existing users of the tool. These will provide a more detailed overview of how to carry out more detailed investigation and analysis using the tool. Healthcare Intelligence Portal can be accessed from the My Dr. Foster homepage using your usual username and password. This will have been set up for you by your local administrator. If you require any support resetting your password or accessing your account, you can either choose the Forgotten Password option right at the bottom of the login page, or alternatively, you might want to contact our customer support team on the details provided here. So I'm now going to log in to the My Dr. Foster homepage, and on the left-hand side, you will see under the tools that you then have the option for Healthcare Intelligence Portal, which you should select. When you first log into the tool, you will see the blue note which is provided on screen. This provides a summary of the tool, information about your existing peer groups, and also some useful information on browser compatibility. If you click into OK, you'll then be taken directly into the tool. Once you've logged into the tool, you'll see that you're presented with a dashboard that provides you with a summary overview of any negative alerts that have been generated from mortality. I'll briefly now talk you through the information presented and these various filter options which are available. At the top of the dashboard, you'll see that there are a number of different filter options which are available. So this initial filter option, which looks at service, allows you to select a particular area of interest. The alerts view is automatically set up so that within the dashboard you will only view negative alerts. This can be customized, and if you want to provide, for instance, a more balanced picture, you might want to select positive and negative alerts, or alternatively, just choose those diagnoses and procedures that have generated positive alerts. By changing the filter to include both positive and negative alerts, the size of the dashboard will increase notably to reflect those diagnoses and procedures that have generated both positive and negative alerts. The QSUM detection threshold allows you to change the sensitivity of the threshold used, and again, this will reflect the subsequent alerts that feature within the dashboard. You can select the maximum detection threshold at 99.9, or you can choose one of the lower detection thresholds at medium and low. By selecting these, you're going to see an increasing number of QSUM alerts which feature within this initial dashboard. So I'm just going to take that filter back to that high detection threshold. The filters to the right allow you to specify the time period that you're looking at, and also whether you want to show a time lag, which will exclude either the latest 1 or 2 months worth of data from this initial dashboard. So I'm now going to provide you with a top-level overview of the data and metrics presented within this initial mortality dashboard. So this initial table provides an overview of those diagnoses and procedures that have generated QSUM or relative risk alerts. The QSUM column highlights the number of positive or negative QSUM alerts that have been generated. QSUM or cumulative sum charts are used to detect small sustained increases in risk relating to in-hospital mortality, long length of stay, and emergency readmissions within 28 days. The bells tell you how many alerts have been generating during the most recent 12 months of data, if that's the time period that's selected in this initial filter. The volume refers to the number of super spells for any given diagnosis or procedure. The observed and expected figures refer to the number of patients who died compared to the number of patients expected to die. If you would like any more detailed information on how we calculate a patient's expected risk of mortality and the case mix factors taken into account, you might either want to use the Information tab provided just above the table, or alternatively, for more detailed information, you might want to refer to the Dr. Foster knowledge base, which can be accessed through the initial My Dr. Foster homepage. The Percentage tab refers to the actual mortality rate. You will then see a relative risk figure presented, and also to the right, a trend for relative risk during the most recent 12-month period. For mortality, the relative risk is calculated by dividing the actual, so the observed number of deaths, by the expected number of deaths and multiplying this figure by 100. To determine whether these figures are significantly different, we've colour-coded the relative risk figures. So red tells you that the figure is statistically significantly higher than expected, black is within expected, and those in green are significantly lower than expected. And again, for a more detailed explanation of relative risk, you might want to refer to the information provided on our knowledge base. For each diagnosis or procedure, you can also then see whether there have been any alerts that have been generated relating to patients who incurred long lengths of stay and were readmitted to hospital within 28 days. The tables beneath the main dashboard provide a summary of the diagnoses that have the highest observed rates of mortality compared to what would have been expected, and on the right, the highest rates of mortality. The data presented in the length of stay and readmission dashboards are presented in the same format, but obviously relates to patients who incurred long upper quartile lengths of stay and those patients who were readmitted to hospital within 28 days. I'm now going to go back to the mortality dashboard. If you're accessing the tool as a commissioner, so by clicking just under your name, if I go back, what you will see is that you have the option to view the data either as a commissioner or to view the data as one of your main providers of care by using this top drill down, so provider or CCG. What you need to remember though is that when you're reviewing the data from this perspective, so for instance if you were a CCG reviewing one of your main providers of care, what this will do is it will include all patients treated by the relevant provider and not just those that were commissioned by yourselves as the relevant CCG. The option above provides you with access to your user details and is where you can access and edit your favourite reports and any previous groups that may have been set up by yourself. I'm now going to summarise the information presented within the safety dashboard. So this dashboard will show you how a hospital organisation is performing across 15 patient safety indicators. The filters show the volume of patients, the observed figure for each indicator. So for instance, for this first patient safety indicator that's looking at accidental puncture or laceration, it would be how many patients had a puncture or laceration within a given period of time. What the expected figure and incidence is for each indicator, and you can then see the observed and expected rates. We then have a relative risk figure and this relative risk tab that we also saw in that initial dashboard. For each indicator, a relative risk analysis has been performed and statistical significance is shown in red and green using 95% confidence intervals. I'm now going to go back to the initial quality mortality dashboard and demonstrate how you would use the drill down function. So, for instance, if you wanted to carry out a more thorough investigation of a particular piece of a particular diagnosis or procedure and want to start to look at the underlying data. As I mentioned at the beginning, a further training webinar will be available to guide you through how you would carry out analysis of mortality outliers and other areas of interest. So from the initial dashboard, you can simply click on any of the relative risk figures. So for instance, if I wanted to look at non-specific chest pain, I click onto that relative risk figure, and that will then take me through to the analysis tab where I can start to analyse the underlying data. So we're now taken through to the analysis section of the tool. Once in the analysis section, you have numerous different ways of being able to analyse the data from this initial compare section, which you can compare your outcomes to a range of either predefined or customised peers, to the trend section, where you can trend particular outcomes over time, and then the drill down section, where you're able to undertake detailed analysis of the underlying data. As mentioned, a separate webinar will be available which describes how you would use these key features. I hope this has provided you with a useful introduction to Healthcare Intelligence Portal and the features and functions available within the tool.